Good evening. I would like to call to order the regular town council meeting for Tuesday, February 23rd, 2021. At the opening of the meeting, I don't see any new attendees. And so I am going to dispense with my usual introduction and go right to the agenda. So please rise for a moment of silence. We'll have the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Clerk, would you please call the roll?
Fishbein.
Here.
Laughlin.
Here.
Barone.
Here.
Morgenstein.
Here.
Shortett.
Here.
Tata.
Here.
Testa. Zandri.
Here.
Chairman Cervoni.
Here. Thank you. With that, on to the consent agenda.
Mr. Chairman, I move we approve or accept consent agenda items A through L.
Second.
Moved and seconded. I think I heard Councillor Tata with the second first. All those in favor signify by saying aye.
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 Any opposed? Hearing none, the consent agenda passes. Item 4, there are no items removed from the consent agenda. On to item 5, the public question and answer period. I don't see anything in the chat bar as requests.
I have a question, Chairman Cervoni. I'm sorry, I didn't do that. Am I supposed to do that? I'm sorry.
Mr. Comerford.
Yes, is the Mayor Dickinson available?
I see he just arrived on the call.
All right, is he situated now to answer a question, or should I wait?
I'm present.
Mayor, the cemetery wall has been determined to be maintained by the town since its existence. The gates, which are part of the wall, and its reinforcements were impregnated into the same wall at the same time of its construction. Is it your position that both fall under the same control of the town?
If you're asking, do I think the gates are part of the wall? Yes, I would assume so.
So, and thank you. So just to confirm that the gates in the wall are part of one construction that was done in 1911, and it falls under the domain of restoration, maintenance, so forth of the town of Wallingford, correct?
I don't know that all of that is true. No, I don't know that's true. I think it all falls under the historic designation, but I'm not sure when the gates were built. If some were replaced, I don't know the history of the gates versus the wall, but in general, the wall, the gates fall under the historic designation.
Right, they were all done in 1911, when everything was done at the same time. That's why I said they were impregnated in the wall. So my question is, for clarity, is they're all maintained by the town then, based upon the relationship between Janice Small's opinion, which was the wall is solely maintained by the town, so therefore the gate should be too?
I believe so.
Okay, thank you very much. That's all I have, Chairman Cerrone. Thank you.
All right, that's all I have for those participating digitally. I will check now the telephone. Anyone else? All right, with that, we will close the public question and answer period and move on to the COVID-19 update. Mr. Civitelli, are you with us?
Good evening, Mr. Chairman. Good evening, members of the council.
Good evening. I suppose you want my screen.
That would be great. Thank you.
How's that?
Awesome. Thank you very much.
Yep.
Again, good evening, everybody. We'll just kind of go through our report as we normally do, and I'm sure we'll have some questions at the end. If we could hop to the second slide, we'll get right into it. So as you could see, the monthly confirmed case totals have obviously dropped somewhat dramatically over the last month. Again, those are the cases that we have seen in our Connecticut surveillance system that we're utilizing. And obviously, while February comes to an end, we'll keep adding up those cases. But as of right now, we do see a reduction in overall cases in town as we have across the state. So that's a good trend at this point that we're seeing cases trend downward. Another good trend that we're seeing statewide, our hospitalizations have continued to plummet. Since the last report that we had on February 9th, we've seen roughly a 35% decline in hospitalizations. We're down around 500 as of today, so that's a good thing. Typically, hospitalizations are an indicator of what's to come as far as a projection. So the fact that hospitalizations are dropping tells me that there's a few things working in our favor, whether it's case rates statewide and some of the vaccination efforts statewide are starting to have impact. I updated the fatalities from the state website as of 2/18. And again, we had several more fatalities since our last update. And again, we're showing here that the number of total tests conducted in town are well over 100,000 now. So we have ample testing for sure in the community. Here's our map that we watch pretty frequently. Again, we're seeing roughly a 40% drop in a 14-day rolling average over cases in town. We've also noticed that in our region. As you could see, a map that was all red previously is now starting to sprinkle in some other colors, which is good. So my summation is that if cases continue to drop, this map is going to look significantly different in the coming weeks. So this is something that's good for us as a community. As rates continue to drop statewide, we're going to obviously continue to monitor this as we move forward. Again, another thing that's obviously on the decline for us as well is when you have less cases, you have less to contact trace, which is obviously good for us at this point with everything else that we have going on. So again, we have roughly 32 individuals that are residents that we're watching as of this point. So I just put two slides together related to clinics. So as you'll see here are the clinics that we've completed. I didn't go back into December when we started doing the ones for first responders, for police and fire, and our school nurses. But this is the ones that for our community. So as you can see there, what I did was to show what dose was provided, the date of the clinic, and the amount of vaccinations provided. We've done quite well as of late. And the next one will be clinics scheduled. So as of so this coming Thursday, we have a relatively large clinic planned for 420 individuals. So in the last eight days, we did one. We're going to have one this Thursday. We did one this past Saturday, and the prior Thursday, we're going to have done roughly 820 vaccinations in that short time period. My hope is that allocations will continue to rise and we'll be able to satisfy the standby list that we've generated, our registration list for those 65 and older. And again, those are the clinics that are currently scheduled, and how many folks we get to will obviously be based on our allocations. And then here's a newer map that the state of Connecticut has put out, similar obviously to the rates in terms of cases. This is showing the percentage of individuals vaccinated in a given community. So right now, the town of Wallingford has roughly 17% of our population has received our first shot. What you'll notice here is the colors that are darker in this particular case are actually ones that have higher rates of vaccination. So I think based on the numbers that we have for town, we're in pretty good shape in terms of how the percentage of individuals in our community vaccinated and those who have access through multiple paths. So I think that's a good thing at this point, that we're doing quite well in that realm. So I guess I'm sure there'll be a lot of questions because there's a lot going on in many different ways. These last few days have been quite interesting for our office, so I will defer to the council for questions.
Thank you, Mr. Civitelli. So my question is about getting vaccinated. So for example, for the clinic that you have on the 25th, where you're dispensing, was it 460? Are all of those reservations taken? Are those vaccines all committed to people already?
Yeah, so what we've done is every town, every health system has kind of come up with a different means in which to register people. So what we had done is because everyone was having statewide an issue with VAMs and registering online, we did a telephone-based system. And basically what we did is as people called into town hall, we put them on a registration list. And as they called in, when we received vaccine, we then call them back and schedule them. So for example, this coming Thursday, there's 420 vaccines that we have available to us. 200 will be second dose vaccines from previous weeks, and 220 will be first dose vaccinations from our registration list. So as we have vaccine available to us, if we get, like this week, we had X number of vaccine available to us on Monday, we schedule the clinic for Thursday, we start calling folks and say, hey, are you available for this Thursday? I have a vaccine appointment for you available at this time. So that's kind of the process that we've had at this point.
And are people calling your office to reserve?
Correct. So as of right now, we have roughly February 11th, I believe, the 65 to 74 bracket open for reservations. At that point in time, we had a little over 130 individuals still left over that were 75 and older. So we still had to satisfy that group. Simultaneously, when the governor opened up that new group, we started taking names. And now that we've kind of caught up with our 75 and older folks, last Thursday, we started going through our 65 and older list. And so we're just going right down the list. And I think to date, we'll have done roughly 300 folks on that list. And after Thursday, we would have done 500 folks from that list for first dose vaccination. So we're making progress. However, we are throttled back, obviously, by vaccine allocation. And what I think is happening too is a lot of folks that have sought appointments elsewhere are having issues getting second shots, and they're trying to get into our clinics for second shots, as well as those who have gone to hospitals to get appointments and the hospitals have canceled on them. Then they've come back to try and get on our registration list. So for every 200 or 300 people we do, it seems another 100 to 200 people come back on the list and having access and having issues getting access elsewhere. So that seems to be, it's a push and pull right now with how we are able to vaccinate folks.
Thank you. Councillor Zandri next.
Thank you, Mr. Chairman. How you doing, Stephen?
I'm doing well. How are you?
Great. So just a few questions. So, we're as you kind of mentioned, we're getting to the point where we're going to be starting to have some of the other age brackets coming in there to get the vaccine. So I've got a few different questions from some, different residents. They had some questions about what happens after they get, both sets of, both shots. So they're basically, they've gotten the full series of shots. So one of the questions I got was about the mask mandate. So one of the questions I got was, is there flexibility in the masking mandate, or is it still just a complete mandatory thing? You might recall early on in the masks were optional. If you had a medical issue, you didn't have to be able to prove it. Then you had to prove it. So now that we've got people getting vaccinated, are these people going to be able to come in and say, look, I don't need to wear a mask because I've got my vaccine. Here's my vaccine card. Or is it still across the board until the governor lifts it? So where are we on the masking? Is it required, requested? Where are you after you get your shot?
A great question. It is still required in the executive order. However, there is a caveat to that. If there is a medical note provided by a physician that says that for the individual, for whatever, cannot wear a mask, that is the only exemption that is in the order. So it doesn't, at this point, we have not seen any modifications based on vaccination, whether for masking, travel advisory, other things that we've inquired, some folks have inquired about to this point.
So then that same is true. So if state X is still under our travel advisor, we come back from state X, even though we've got the vaccine, we've been vaccinated. If there's still a 14-day, secure yourself at home, you still have to follow that even though you've been inoculated.
That's the guidance as of right now. However, my suspicion is as the vaccine becomes more available statewide, the presumption is that may wane or have to be modified, but I have not seen anything to date or heard that was going to happen specifically.
So I have some more questions, but I'm going to kind of jump in there with my own. Why doesn't the requirement get less, I don't want to say less restrictive, but I mean, the idea is if someone's got their shot, they're vaccinated, can they still get sick? Can they still transmit it to somebody else?
So if somebody is fully vaccinated, and by that I mean has 2 shots, and 14 days after the second shot, they're considered fully immunized. What we're seeing is that if people test positive after that time period, they're typically asymptomatic. So it's an interesting situation where the vaccine is essentially creating asymptomatic carriers, which we've seen more in long-term care facilities. That's what I'm really using as our baseline. There's folks who are still testing positive in those facilities. It's just they're not requiring hospitalizations now, which is kind of bearing out in the numbers as we've seen hospitalizations decline roughly 2.5 months after that population started being vaccinated. So that's what I'm seeing. But yeah, I understand your point.
Well, I guess that also, then it's going to lend another question now. If you're fully immunized, how can you be an asymptomatic carrier at that point?
I think what's happening is you can still contract the virus. However, it's almost like the flu shot. So in a way where you could still get the flu, but it may reduce your symptoms, even if you still get it. That's kind of how I'm trying to equate it. And that's from what we're gathering in terms of data, that hasn't really been articulated from government sources or other entities at this point, but that's the data from what I'm seeing and talking to folks now that we've been vaccinating people for, over 2 months now. That seems to be what's happening.
All right. I guess my ask would be and I know you do your best already to bring us information forward. So, I mean, I'm going to make some asks of you because people, I always direct them back to your department anyway, but people, whatever, they send me an email, they message me on Facebook, and I try to get answers from them. And so I think this is going to start to become potentially an issue without having all the information present, because people are going to, but I can be lackadaisical now because I'm inoculated. It's like the flu. I got the flu shot. I don't have to worry so much. I'm going to go out. I'm going to do this. And they're gonna be told to put the mask on. They'll put it on. There's not too many people. They're gonna challenge that in a restaurant and so on and so forth. But I think people's mindset will be, I can't get sick, which doesn't sound like it's true. And I can't make other people sick, which again, doesn't sound like it's true. I feel like we need to make sure that we've got a definitive list, even if it's a pointer to, the portal up in Hartford. If the portal says, hey, X, Y, and Z, then we can at least point them to the state portal where it shows this, because I think without it, people are going to speculate and then they're not going to have solid answers. So, I guess as those links become available, or if the information is available, you can ask and give it to us at the next update. These things would be very helpful, I think.
I agree. And I think what I have just said is more me talking as, the local health director, as opposed to what's coming down from the federal government, because there has been limited data as to transmission after vaccination. There's not a lot of studies being done because they're essentially being done simultaneously in the communities now after the programs have run out or been rolled out nationwide. So I think that in the coming months, I hope that we will have more data that shows after the shot, you don't transmit it as easily, or we'll have more evidence to show how effective it is, besides the 95% efficacy numbers that we've all heard about. So I agree. It would be nice to have more information. And I think as more information comes out, that'll modify the executive orders from the governor.
Makes sense. Okay, I'm all set for right now. Thank you very much.
Thank you.
Next is Councillor Morgenstein.
Yes, thank you, Mr. Chairman. Thank you, Steve. Yes, so my understanding is that the way the vaccine is built, it does not prevent transmission. But yes, everything is this novel virus. We're trying to understand it. The virus vaccine has been produced and everything is continuing to be studied. I think the big message that so many people don't really think about, because you wear a mask and you tend to think, I would wear a mask so that germs are not coming toward me. But the masks that we wear are to protect other people. And I think the biggest take-home message, which is a bit lost right now because all of the press and the media is concentrating on the vaccine is here and who can get it and, why is my group not yet getting it? The big message is you wear that mask to protect other people. The goal of protecting our entire community is one that we should all still be having in mind. And if we loosen up too much, herd mentality is what we need. Herd immunity is what we need in order to really be able to free up our lives again. And we're not going to have that. Steve could probably answer the question. It's something like 70% of the population needs to be vaccinated in order to have the herd immunity that really makes us be able to free up. So yes, I wish that the what's being presented by the media were less, not that it should be less about the vaccine, but they are, like Steve says, still learning. Is that 70% number correct, Steve? Do you know?
I've seen, typically you're correct. The herd immunity discussion usually revolves around 70%. I've heard other experts from the federal government as of late mention 80%. However, one thing I would say is that while you do it through vaccinations, you also have to evaluate natural infections as well. So obviously that's something else that I think we're also struggling with, where if you have X people vaccinated, you have to also look into, well, we have X number of people that have contracted the virus and what's their immunity and for how long, because that would also expedite the numbers to herd immunity. And that's something that for public health purposes, we've always acknowledged is natural infection does provide immunity. I guess in this case, we'd have to say for how long, we don't know yet. But again, that's something else to your point that we have to evaluate and the science has to catch up.
Yeah. And then the other thing that I thought was worth bringing up tonight, I think there were people who were disappointed, surprised that the state is simply going by age rather than by condition. And my impression on that, and this is again, yeah, just my opinion, is I had been asking you all along, how are we going to determine who has what condition and who finds out that they have it to prove that they're eligible? Is it correct that the state came up with just going by age? Because if we made the whole process more complicated, we might slow up our giving of vaccines. Do you have any insight into how that was chosen, that we've gone different from other states and gone straight age?
So as a member of the allocation committee, I know that the allocation committee had been going through, as you described, different critical workforce groups, ages, et cetera. Ultimately, I think the governor made the decision to base it on age. And as of March 1st, as I'm sure many of you have heard, so they will be opening up. So we just opened up 65 to 74. February 11th, and on March 1st, they're going to open up the portal for those who are 55 and older and those who are educators. So what we've been tasked with locally is, maybe I should back up. So we still have that large list of folks that we've made commitments to that we're going to continue to move through. And so when the other age groups open up, we are going to hold off from taking folks until we satisfy that other list of people, which again, based on the allocations we're getting, could be another 4 to 5 weeks in all honesty. And, you know, I don't think it's going to be easy for our folks on our registration list to be able to go elsewhere at this point, as it was before, to go online and to try and find something in VAMS. Some folks will, again, as we call people to make appointments, some appointments we're able to get some online, but the majority of people actually are waiting to come to our clinics. They do not want to leave town. They want to stay here. They've heard good things about our clinics, so they want to stay here, and we're more than happy to oblige them. It's just going to take time. So the other thing, to your point, so again, the state has told us that local health departments are to partner with our education workforces in our community and to set up separate clinics for them. We're working on that now with Dr. Menzo and other entities in town to try and work through that. Again, all of that's going to be based on allocation. A separate allocation form for educators was sent to me today, and I filled it out based on the numbers we had. But again, we plan on satisfying our residents 65 and older because we recognize those are the most vulnerable, and simultaneously working through the governor's, at this point, his allocation plan to have every educator have their first dose vaccine by the end of March. And I worked with Dr. Menzo today, and we put a proposal together. Again, it's all predicated on allocations to the town. And again, what I think will happen is, as the weeks and months go on, is we will satisfy our list for those 65 and older because they're the most vulnerable. We will satisfy our educators and our workforce based on the age demographic. And then where our plan really come in May is to start scaling back some of the clinics and going mobile to get those who are the most vulnerable, who do not have insurance, who are homebound, etc. So that's the overview of how we envision this going in the next several weeks. Obviously, it was slightly different a few days ago until things changed abruptly, but fortunately, we're able to pivot and respond appropriately.
And when you say educator, I had seen something about the entire workforce inside schools
Correct.
being eligible in this next round.
Correct.
Okay.
We've estimated that number for Board of Education to be roughly 1,000 folks. Again, there's other educational facilities in town that we're going to try and help meet their needs as well. Again, it's going to be a monumental task to try and meet in a short period of time, but we have a lot of great partners, many of which who are on the line tonight. I could see Chief Highgard and Deputy Chief Wilson. I think I see Joe Setnar, Deputy Chief Setnar. Them helping us with their paramedics has been crucial in trying to meet the demand of the community. Again, working with the school nurses, the fire department, Choate, Masonic. We've been fortunate thus far, but I think that March is going to be a busy month for us, for sure.
Absolutely. Thank you. Thank you. I'm all
Thank you.
set.
Next is Councillor Tata.
Thank you, Mr. Chairman. Mr. Civitelli, when you just brought up educators, this question came to mind. Are the educators being required to get the vaccine, or we're just setting up the clinics to make it easier for them to get their vaccine?
It's voluntary. So what we've decided to do in town, and I know some towns have decided to allow their employees to go look elsewhere through VAMS, which is fine. But I think what'll happen is if you have 1,000 Board of Ed employees scattered trying to find appointments, it's going to create other issues in the school system. So we decided that, the plan was all along was to vaccinate the critical workforce, and we wanted to do it in a controlled fashion, something that was done safely and something that we kept in town where we could provide a level of certainty for our employees because they deserve that. And then the other side of it was we didn't want folks to have to worry so much about the second shot. That seems to be one of the biggest, most frequent calls we receive are help from people outside of town trying to get into our clinics to get second shots because theirs were canceled from other areas of the state.
Okay, thank you. Thank you, Mr. Chairman.
That's all I have from the council. Going out to the public. Mr. Comerford,
Yes, can you hear me?
I can.
Steve, first off, I like to commend you guys. I always said this, and for the past 10 years, you guys run the best department in the town of Wallingford, as far as I'm concerned. That's only my personal opinion. Looking now at Texas and the severe snowstorms that they have, are we prepared for something like what they've just incurred in Texas? Meaning, is our town prepared for a catastrophic event? Are we equipped for generators and the ability to handle everything? And I don't mean that, this pandemic that we're having, but the pandemic that the catastrophic situation that they're experiencing in Texas.
Is there you asking specifically about certain items that we have to address in our plans?
You and I have chatted for years about it, and my position is that we're not prepared for a catastrophic event, that something like this might happen where we are not able to have generators, ice, water, the ability to handle something, whether it be in the summer or the winter. And I'm just looking for your opinion as to, are we prepared for something like that besides the pandemic that we're experiencing right now?
So,
Mr. Civitelli, if you feel qualified to answer it, that's fine. This is really the COVID report. But
it's a multifaceted issue that encompasses multiple offices. I could speak to a portion of it, but I can't cover everything in that question.
right, I would only expect you to address what you know as head of your department.
Understood. So, Mr. Comerford, so to your question, we have preparedness plans under ESF 6 for mass sheltering. We've always worked with Office of Emergency Management and our Emergency Management Office to try and work through plans in terms of how to shelter folks in place throughout town. At this point in time, as I'm sure you're aware, we have 2 primary locations for emergency sheltering, one being our primary being Sheehan, our secondary location being Lyman Hall. And then we also have a smaller scale down shelter at the former Yalesville Firehouse. As time goes on, as I'm sure you're aware, we continue to build capacity, whether it's cots, blankets, supplies, personal care kits. And so that mission continues. And I know that, yeah, so that's kind of what I could speak to at this point.
So if I may interrupt real quick, which one of those are generated?
So as of right now, the former Yalesville Firehouse is the smaller scale shelter is currently generated.
And that's it.
Mr. Comerford, this is off the agenda, and you're really asking questions.
Chairman Tony, you have a tendency to cut me off, and I don't really appreciate, because at the end of the day, I think that my questions are vital to the community, and I really don't personally appreciate it. If I need to put it on the agenda, then I'll specifically, from here on forward, direct it to you. So from here on in, I want to be on the record that I would like every item that I request directed to you and put on the agenda, because I think these are vital.
Mr. Comerford, you're done. If you don't have a question about the COVID report, you're done.
I do have a question about the COVID report.
Well, then focus on that, please.
Mr. Cervatelli, as far as the COVID report goes, with the amount of people that are getting tested, and now that we have a outsourced research entity coming in, which is Hartford Healthcare, coming into Oakdale Theater, how does that play into our ability to get the shots delivered to the general public in the town of Wallingford? Does it expand to New Haven, North Haven, or the surrounding community?
That's a good question. So Oakdale's site is going to be operated by Hartford Healthcare, and it's going to be a regional site. So it's something where they're going to have you're going to be able to register through My Chart or a phone number. We've given that phone number out quite frequently as our lists have grown. So again, it is going to be a regional site. We are going to try and assist in any way we can, help support that site, because it is in town. So they did request from us some volunteers from the regions, not just Wallingford, but the region's public health workforce, which is something we're going to help facilitate. Again, I think it's good to have another operator in town where we're going to refer folks to. Obviously, at this point, with our wait lists being what they are, it's good to have another site in town for sure.
So is that on the town website? Is that on government TV? Have you reached out to those entities to make it,
Yes, we did put out a press release that was on the town website, letting folks know that they could register on through My Chart or the 860 number that they have through Hartford Healthcare. And we also tried to send it out to our local partners, the Spanish Community of Wallingford, the YMCA through Park and Rec, because they have quite extensive mailing lists, just to try and get the word out as best we can. Typically, in all honesty, Bill, is when folks call us, we put them on our registration list with the expectation that it is going to be several weeks, but then we also try and provide as many alternatives in case, in all honesty, they're able to get an appointment sooner. And we're very comfortable with that.
And I understand that. I appreciate that. And forgive me if I miss it. Is Board of Education on there too? Go ahead.
I'm sorry, what were you saying? Is Board of Education able to get appointments through that site?
No, what I'm saying is that is Board of Education on that blast too? I don't know how this town works, because as far as computer blasts and so forth, I'm not privy to that. But what I'm saying is that with Board of Education, do they get a blast as far as a situation where you're recommending as a town health director that the ability to get tested based upon your age or requirements is available at the Oakdale Theater?
Typically, we will pass along a messaging. Obviously, today, Board of Ed sent out our potential, our tentative vaccination schedule for all Board of Ed employees. I don't know if any of you saw that, but again, yeah, so they're usually pretty good about putting the word out for us on our behalf.
So they're aware that the Oakdale Theater should be available.
Yes, actually, in all honesty, we had Oakdale reached out to us in the last few days. They're going to be doing a dry run on the 25th. And we actually gave them 25 eligible Board of Ed employees that were 65 and older to do their dry run. So again, they were, they're trying to work with us and help us speed things up locally.
All right, great. Thank you very much. I'm through, Mr. Cervoni.
Mr. During, you're next.
Action Deering, Aaron Drive. First of all, Mr. Civitelli, thank you so much for all your hard work on this wonderful report to hear that cases are, people are getting vaccinated. Really we're moving in the right direction. Just had one quick question. You had indicated in your report that 17% of the town's population has received their first dose. Do you have numbers as to what percent of the town has received their second dose as well?
I do not at this point. I could only tell you about those who have had clinics with us, have received their second dose. But again, that's when we're vaccinating, primarily residents, when we also vaccinate some of our workforce like police, fire, school nurses, that crosses our jurisdiction. So the state hasn't tracked yet on that map second doses. They've only given first doses, which is at this point a little over 17%.
Thank you very much.
Thank you.
That's all we have for electronic. And I don't see anyone else who's dialed in on the telephone. Mr. Civitelli, thank you very much for all of your work.
Thank you, Mr. Chairman. Thank you, members of the council. All I would say at this point is to those who have registered with us, just hang in there with us. We're going to get to everybody. We haven't missed anybody yet on that list, and we're not intending to do so now. So we'll get to everybody. It's just going to take a little bit of time. Thank you.
Thank you. Have a good night. On to
Good
item
evening.
7. Can we have a motion, please?
Yes, Mr. Chairman, do you want both A and B all motion together or separately?
You can move them
What is
together.
the preference of the chair? Thanks. I figured that was easier. I move we approve a transfer in the amount of $80,000 from regular salaries and wages account to the replacement pay account for the fire department, and a transfer of $40,000 from the general contingency account for the town, $30,000 from the accrued contingency account for the town, for a total of $70,000 also to the fire replacement pay account.
Second.
Moved and seconded. I think we have both Chief Heidgard and Chief Sentner on the call.
Good evening. Thank you, Mr. Chairman. This is Chief Heidgard. And good evening, councilors. So for your consideration is the second transfer that is necessary for covering our replacement pay shortfall. And to give you some numbers so that you can get a snapshot of where we are and how much has changed since the first introduction of this issue. We have 17 pay weeks remaining in this fiscal year. In this budget line as of today, we have 63,000, just short of 64,000. If this transfer is approved, we'll have $214,000 or approximately that available for this use. We anticipate that funding of $214,000 will get us between 10 and 12 weeks deeper into the fiscal year. That brings us to mid-May. And if we can get that far, so say 11 weeks, that means we have 6 weeks remaining in the fiscal year. The transfer, if it's approved to date, the town's contribution to the shortfall will be $229,000. The rest has been moved from within the fire department budget. Our anticipated next request or last request for those last 6 weeks, there's a lot of variables that are still in play. I'll get into a few of those in a second, but we're looking at a shortfall remaining after tonight, somewhere between $100,000 and $150,000. That's significant in that the shortfall, therefore, outside of the fire department budget is projected to be somewhere between $329,000 and $379,000, which roughly, let's go with $400,000. That's $250,000 less than our original $650,000 projected shortfall. So a silver lining in a difficult discussion. Factors that we had that have changed. So when we first came to the council with this shortfall, we had 4 long-term injuries at that time, and we had 2 open positions, and undetermined COVID impact, depending on quarantines, members, and whatnot being unavailable for work. Since that time, we've had 2 of those injured members return to full duty, so that's been a great help. And due to the aggressive preparedness and the support from the council and the mayor's office for personal protective equipment and whatnot, we've kept our members healthy. We've had less than anticipated COVID impact. So again, with that, we're anticipating that reduction in our shortfall. So that's the explanation I have, and open for any questions.
Thank you very much. Councillor Laffin.
Thank you, Mr. Chairman. Good evening, Chief. You hit on some of my questions in your conversation. So we had $860,000 before tonight, another $150,000 tonight. We're over $1 million. We've got we took $1,500 from the volunteer abatement program last meeting. I'm sorry, a couple meetings ago with the 860, and now last meeting we had to put 1,500 back. Are all these budgeting snafus going to get, are they hammered out in the next budget? Like, is this all related to the change in operations between, you know, the fire and emergency services? Like, what is the real cause of all the chaos with all this? Because it seems to keep snowballing.
Well, actually, it's the money that was transferred from the volunteer fund. We had an outstanding debt that we were waiting for documentation from a town, a volunteer who resides in another town. That was a new issue because that just, as you're aware, became approved last year through state statute. That's an opportunity. So there was a paperwork snafu there. So basically, when we thought that budget line was completed and our debts paid, we still had an outstanding debt to pay. That's a unique event there. This budget line was shorted. I should have included $200,000 in our existing budget request last year that was missed in my final budget submission. So I underfunded this line by $200,000. The other new cost is due to the staffing changes. So because we have no experience with the new staffing model, that's the shortfall that is beyond the 200. So that would get us to $1 million. We do anticipate a shortfall of 129 to 179,000 beyond that in the existing budget. So now that we have a year's experience, yes, in the upcoming budget, we've addressed this with, again, a year's worth of experience with the new staffing model.
So are we looking at $1 million increase in the fire department budget for next year?
$1 million, no. So because we already had 800,000, again, the shortfall outside of our budget this year is between 329 and 379. Now there's going to be other increases because there's step raises, there's percentage increases and contractual obligations. So there are increases.
Right. So those are outside of our of the original fire budget. So remind me where the other money was transferred from within the fire budget and how that's not going to carry over to next year. So we're foregoing expenses this year already, and you're not going to carry them forward into next year. Is that what you're saying?
No. One of the things that happens every year is when we have open positions, as we do have 2 open positions we've been carrying through this entire budget. We gain ground in general wages because we're not paying a salary, and we have to pay at time and a half in the replacement line. So anytime we have an open position, it's funded in general wages. As the transfer you see tonight, that 80,000 is due to that. Now we're still gaining ground there. However, if we are able to fill, we hire somebody between now and the end of this fiscal year, that obviously will change. So those are variables that they happen every year, depending on how fast we can fill open positions.
So is the plan banked on not filling positions that you're asking to fill, or planning to fill, or trying to fill?
We are continuously trying to fill. We're working with human resources
So
to do that.
So if we fill those positions, then what? Then we don't have that money available in the next budget.
But we also don't have the drain out of the replacement pay because they're filled positions. As those people are vacant, because we basically staff man for man. So because we have minimum manpower, anytime there's a vacancy, we have to fill it. And you're using time and a half to fill the open spot every day that person comes through their schedule.
So this won't connect through the difference or the differential between the EMS and the fire. That's all resolved?
I'm sorry,
of positions, because we have the we have the EMTs, and then we have the union fire guys, right? So
well, they're all in the same union, but there are two job classifications. There's the EMTs and the firefighters.
Right? So the classifications, right? So the classification discrepancies has been hammered out, and that will not be an issue in the next budget. Is that what you're saying, or that's what I'm asking? Yeah,
it's the openings right now are 2 firefighter positions are open. There are no openings on the EMT side. So there's 16 EMTs and 56 firefighters. As the firefighter for firefighter, EMT for EMT. So the category that's creating some of the overtime, those 2 open positions, there additionally are 2 injured firefighters. So there's 4 openings on the firefighter side. So yes, if we can get those filled, either the 2 open positions or get the members back healthy, then yes, this use of replacement pay will be reduced. So it's per person on the fire side is about $2,500 a week for every one person that's out.
And that would be good. So then it's not relative going to the next budget. I guess that's my concern. Like, because we always I assumed anyway that you and the chiefs before you have padded the budget to balance, because we have a vacancy, or we have 2 guys out injured, or we have something, right? Like that's part of the padding. Like, so that's all factored in. We're not going to see $1 million increase. We're only going to see a $300,000 increase.
Well, I don't want to speak too much because, again, in the budget process, I haven't even met with the mayor yet to,
Sure. Okay.
On the new budget. But yes, it is accounted for in that. To your point, I won't call it padding, but if it's an opening, we don't pay for fringe benefits out of our budget. So when we're paying time and a half, that we don't have the makeup for that in the general wages. It's straight wages, just time and a half wages, which puts us in the hole by 50% on everybody that's out. The town is more equally made whole. The taxpayer is made whole because we're saving on fringe benefits for the opening. But to your point, we don't have any contingency in the budget. There's as you know from today's article in the paper, our budget usually comes in less than 1% surplus. So therefore, we don't have contingency.
Yeah.
Right. We did have, and the question was raised the first time we brought this up, that in our old staffing model, our shift strength number was higher than the minimum staffing number. So we had more cushion for people that are out. In this model, we're shift strength of 14 and we staff at 13. So we only have a buffer of 1 firefighter, and we don't have a buffer at all for EMTs. That's why it's virtually a man-for-man replacement. Somebody's out, we fill, with the exception of that 1 position. But that 1 position, again, is consumed by the 2 long-term injuries and the 2 vacancies. So to your point, yes, we've addressed it for next year's budget so that this shortfall won't happen again. But we still have all the variables. We could have heaven forbid, multiple injuries or long-term fill issues as we're having now. You know, we're trying aggressively to hire, but there's a delay in that process. COVID did not help that process
No,
in
not
any
at
way,
all.
shape, or form.
So this is less COVID and more getting used to the new system than we originally thought or were told or we believed last fall. Last winter.
Yes, as the experience is happening, yes, we saw less impact due to COVID, but that's also why we went from the shortfall expected of 650 to now 400,000, because that was the difference in the COVID impact.
Yeah.
The shortfall now is directly related to the open positions.
Okay.
So yes.
Okay. And we didn't, and the council did not reduce the fire budget in some of the cuts last year when we were trying to get to zero, correct? This is just,
No, you did not. No,
so
absolutely not.
just so that the rest of the town's not confused, and because I know there's been some other departments, but that was not the case here. This is a separate issue. Okay.
That's
All
right.
right.
Correct.
That is it for me for right now. That's it. Thank you.
Councillor Tata?
Thank you, Mr. Chairman. Head Chief, I just have a question about I know we switched to the new staffing model this year. Can you just kind of explain that a little bit? I've probably asked this question before, but I'm still a little bit confused as to how that new model works. And now I also wanted to ask you, now looking back on this, I think it's been about a year. I know there were extra costs because of it. A lot of these requests seem like they're because of that. Looking back now that you've had this model for a year, do you see that was a good decision, a good operating decision for your department? And so any comments on that, I just appreciate. Thank you.
Yes, thanks for the opportunity. Yes, that is something that we look at very carefully. And yes, it is working in every matrix that we can see. One of the big changes was the old staffing model, and we use minimum manpower as a barometer. We exceeded that in staffing, so it confuses the discussion slightly. But we had 12 people on the career side staffed, 2 of which are assigned to the ambulance and 10 on fire apparatus. In this new model, we have 13 people assigned to fire apparatus and 2 people assigned to an ambulance. One of the gains in this new staffing was we added an engine company at the North Farms station. And that is an additional engine with those 3 people beyond the 10 that we had before. That engine has been extremely effective in the fires in that area. I-91 responses, it gets into the Yalesville area very nicely down the Route 68. So that engine and the additional staffing that this model brought in has been critical in multiple events during the year. Additionally, we now have 2 staffed ambulances 24 hours a day. In the old model, we had 1, and on nights and weekends, I'm sorry, during the weekday, we had 2, but daytime only. Nights and weekends, we only had 1 ambulance predominantly. So due to that, again, yes, both have shifted. We've had multiple, this has been a very busy year for fires, as last year was. And this staffing, again, has been critical to the successful outcome of those events. Additionally, in the old model, because we were always looking for firefighter paramedics, that was our staffing, that's all we had. There's a great difficulty in finding people that want that job and have the aptitude and physical capabilities to get that job. So one of our desires was to reduce the amount of need in that area and again, move to an EMT model. That's what we have on the ambulances. Reduce our reliance on the firefighter medic numbers. It's a financial thing. It's partially that, but it's also very difficult. And we're seeing that throughout the state of Connecticut. And I've been talking about in EMS World, a periodical magazine in the EMS sector. In the January edition, Hilton Head Island, which is a desirable department, it's a sizable department, was looking to hire 7 firefighter paramedics, of which they were not able to hire only 1. So again, that's hitting in the Carolinas. It's hitting everywhere in the country, this difficulty to hire. So changing our staffing model had everything to do with not only finances, but improve service to the community, as well as hiring, improving our ability to hire qualified candidates. And yes, we believe in every matrix, it's working.
Okay, thank you. That's good to hear. And the North Farms truck goes by my house all the time, so so I know they're out a lot. The other question I had, and it may not be this may not be the right night to ask it, but I'll ask it anyway. The volunteer situation, is that anything? Because now that we're looking at spending a lot of money for the paid fire department, is the volunteer situation getting any better? I know that you had that class offered, and I was hoping that would have done something, and then I heard you had to cancel it because there was low enrollment. But is that something that you see picking up at all, and maybe that could take a little bit of the the weight away from this budget?
They're not necessarily connected, but they are connected. The staffing model that we have is necessary, regardless of what happens on the volunteer side. We have had very productive conversations with volunteer leadership. In my presentation, or in my proposed budget to the mayor's office, and you will be seeing it, is funding request for volunteer training, recruitment, the necessary PPE or the gear that they will need. Yes, we are making a strong effort in that regard. Again, the volunteer leadership and myself and the two deputies are working hand in hand in coming up with the best methods to deliver that and have a productive outcome. So yes, it's being supported. We are requesting some funding for that. The volunteers still contribute to our system in a great way, and we want to continue that effort of supporting them.
Okay, great. Good to hear. That was all I had. I also want to take a minute just to say too, I know I think I spoke to you when it happened, but our family unfortunately had to use an ambulance recently. And I just wanted to say publicly that I believe it was 3 gentlemen that came were fantastic. The service that we received, during a kind of scary time was wonderful. And so definitely appreciate, the work that you do. And it's one of those things that we know you're there, but you don't really realize how much you rely on that until you need it. So I just wanted to kind of let all of your department know that, we appreciate that. Thank you. That's it, Mr. Chairman.
Thank you.
Councillor Morone.
Thank you, Mr. Chairman. 2 very quick questions, Chief. First, with the COVID situation, a lot of people have shifted from the office to working from home. Wallingford's got a lot of commercial office space. Your call volume, say, over the past year has been consistent to prior years, more or less?
So last year we realized about a 300 call reduction. So we went from about 6,600 to around 6,300 calls. That reduction we noticed primarily on the EMS side, in that some of the things that people were calling an ambulance for transport, they were more concerned about the hospital setting, and they did not call. So they were not the heart attacks. Obviously, the serious calls were still happening. Ironically, the fire and the accident rate has gone up. We've seen a very busy time period in the last, well, beyond the last 12 months, but the crews have been very busy on the fire side and motor vehicle accidents, unfortunately.
Okay, thank you. And my other question, in general terms, how do we, because we see it from the budgetary perspective, but how do we measure the efficacy of a fire department?
When you say efficacy, you're talking about our efficiency in operations?
Yeah, you mentioned certain metrics, and I'm just trying to get a handle on what are the metrics? What do you look at to determine if your department is meeting? What goals do you have for your department by which you could determine if they're meeting your metrics?
Sure. One of the most important is time to arrival on an emergency scene. That's one of the reasons why we've moved to staff the Station 7, the North Farm Station, in that it was identified back 15 years ago that it was taking us a long time to get into that area of town. So by moving an engine there and staffing it, that gets us on scene much faster. So the matrix that we watch is rollout time, how long it takes from the time of dispatch to the truck signing on the air and being mobile. And then from time of dispatch to actually arriving on scene to give care, attack a fire, do whatever is necessary for each of the different scenes. That's our biggest measuring tool.
Okay.
And that's primarily what our goal is. And then we also have programs, QA, QI, so quality assurance, in that we go cradle to grave, if you will, probably a poor term, in a call. And did the dispatchers dispatch appropriately? Did we treat and transport appropriately all the way back to the hospital care? And so that's another matrix that we're using to say, is the BLS model working versus and having ALS care from the engines? Ironically, to talk about the same subject, our anticipation in this new staffing model was that we were going to switch. We were transporting people at a 60% advanced life support care level, when the national average was 60-40, the opposite direction, meaning 60% of transports was basic life support and 40% was advanced. We were the opposite. We've now, through this past 9 months, maybe less than that, from July 1st till now, we've gone back. We're now following the national average. We transport 40% advanced life support and 60% basic life support. The staffing also, another byproduct of this switch, was our ambulance were transporting just over 9 times a day, which took 2 firefighter paramedics out of town, each of those transports. So roughly 18, a little over that by average, times manpower out of town, unavailable for firefighting. The new model, we're at 4 times per day, 1 paramedic is brought onto the ambulance and transport ALS. So we went from 18 man people out of town to 4. So that makes the availability of that staffing much better now than in the previous model. Again, these are all byproducts of the shift that we made with this staffing.
All right, thank you very much, Chief. So, and I guess, well, how would we rank, I guess, amongst area towns in terms of response time and so on, like you were talking?
I don't have information on other towns for that discussion, so I don't know. We see that our goal is to be at 4 minutes or less. That is kind of what we're looking for. And so we QA the dispatch process to make sure the call is processed as fast as possible. Our rollout time is watched and maintained or managed. And then you can't make up time in route to a call. That just creates danger and, asking people to drive fast. So the times we can affect is getting onto the truck from dispatch, the dispatch time, and the locations of your emergency vehicle. So we feel that all those areas that we can impact have been positively impacted.
Okay, thank you very much, Chief, and thank you, Mr. Chairman.
Sure. Councillor Tata is back.
Sorry, I'm back. Something you just said made me think of one more question. I think this is probably going back a lot of years, but I want to say back in the day, it was maybe company 1 that would respond to everything, and then volunteers would kind of come as backup. I could be wrong on that, but I think that's how it used to work. And now I think with North Farms, it's different. Would you mind just running through what departments we have and who is there 24 hours, where the ambulances are? How do we know, who responds to what?
Sure, that's a great question, and it has changed. In the past, we had 2 career stations, one at North Main next to the police department, the other at fire headquarters on the west side of the town. So anything on the western side predominantly was from headquarters. That's where the ladder truck was, an engine, and the ambulance. At a station 1 was an engine, and during the daytime, most recently, was a rescue there. The volunteers, back a few years ago, there was 4 stations that the volunteers had, each Wallingford. So basically, looking at the town, although it's not a square, in the corners of the town, if you will, were the volunteer station. Unfortunately, at this time, the western side of town doesn't have a volunteer presence, but we have the North Farm Station, which is active on a volunteer element, and East Wallingford on Kondraki Lane. And the town is divided up in districts, response districts. So if a call is in the district of engine 3, which is at North Farm Station, engine 1 for downtown and into the East Wallingford, the southern part of the town, and engine 2 covers the western part of town. Those are the predominant response vehicles. And then if it's in a volunteer district, they have a response area that they cover. They also get dispatched on the call. So they also, the volunteers get dispatched to structure fires as well. So anything north of Center Street, North Farms goes. Anything south of Center Street, East Wallingford goes. And they provide additional manpower to those calls. They help on the highway. So they are dispatched about 900 calls a year out of each volunteer station for the total of the 6,600, 6,500 calls roughly townwide. So they're covering about 15, they are additional responders on about 15% of our calls.
Okay, great. And so the three I guess the three paid departments, for lack of a better term, North Farms, Company 1, I think, in the center of town, and then headquarters, those are all staffed 24 hours for fire and EMS?
Yes. So I missed that part. So out of fire headquarters on the west side of town, there's an engine company with 3 people on it, and that's an ALS engine, so advanced life support, with 3 firefighters. The ladder truck has 2 firefighters on it, and the shift commander runs out of there, as well as 1 of the BLS career ambulances. The North Farm Station has a career, it's called Engine 3, has 4 firefighters on it, 1 of which is a paramedic, so it's an ALS engine company, staffed with 4, and a ambulance with 2 EMTs on it, in addition to the volunteer contingent in the same station. And out of the Company 1, the Main Street Station, has 3 firefighters, 1 of which is a paramedic, so it's an ALS engine as well. And that is staffed 24 hours a day, 7 days a week.
Okay, great. So there's ALS service, I guess, in all 3 of those, in all of the departments.
Correct. Yes.
Okay. All right, great. Thank you. That helps, because I know it's changed over the years. So just good to kind of get that update. All right, thank you.
The last piece I'll add is that during the weekday, we also have an Ems Lieutenant, who is a paramedic that also contributes to the response. Again, daily, we see a lot of surge. That's our busiest time. So he's there as well, and that's part of the new staffing model.
Okay, thank you.
All right, that's all I have from the council. First question I have from the public is for Mr. Comerford.
Yes, Chief, can you hear me?
Yes, I can, sir.
How much has I live on the west side of town, on the top of Cook Hill Drive. Since the volunteers have diminished or depleted, how much have we suffered overall, in your opinion?
Suffered is a I don't know if it's quantifiable.
Well,
the west side.
Let me thin that down. Christina Todd just asked you a question. You stated somewhere around, I don't know, 9,000 calls, 6,000 calls, whatever the number was, that the volunteers helped out on. So seeing the west side doesn't have any volunteers, how many calls would the volunteers respond to? And I'm not holding you to this, but as an assumption, how many calls would they have responded to, which would have left our paid volunteers in their position to respond?
I think I understand what you're asking. So in a lot of cases, because the career department is staffed, we respond much faster. Obviously, a volunteer, although they do staff the station at times, predominantly the career staff is going to get out and arrive on scene faster than the volunteer response. So, and that is in fact happening today, like it has traditionally in the past. So we haven't seen a reduction in our response. I'm sorry, we haven't seen an increase in our response time. We've actually seen the reduction in the staffing. The Cook Hill station that's closest to where you are has been closed for many years. So engine 2 coming out of headquarters and the ambulance would be the first ones on scene to your house. God forbid there's any event, but that time hasn't changed in years. So where we've seen drastic reductions in our response time, so improvement, is in the North Farms area, where again, that presence wasn't there. One of the factors on the volunteer side is the length of time it takes from where they live to get to the station to get the truck out. So that's a very wide, very large district. It takes time to get from where the neighborhoods are, where the members live, get to the station. One of the big advantages in that station is that it's on the south side of Route 68. So believe it or not, from the old station to the new station, that short distance was a very difficult transition for the volunteer to get out onto 68 to get to the station. So that's been a great improvement in their response time as well. So there's a lot of factors to your question, but we haven't seen a bad impact because of this new model.
So, indulge me here. So, because Cook Hill has closed down and the one across the street from Sheehan closed down, there has been no impact based upon the frequency of events or who responds, meaning whether it be via the volunteers versus paid.
I wouldn't go so far as to say there's been no impact, but the initial unit arriving on scene is getting there just as fast now as they were before. And yeah, the volunteers, I don't mean this in a demeaning way. It's a supplemental service. They bring additional manpower. They bring additional resources. When the career vehicles are busy, the volunteers respond. They may be the primary unit responding, and sometimes are. But our first arriving unit that has the most impact in a fire or a medical event, that time hasn't been changed based on those stations closing, because the first unit arriving on scene in most events was the career piece. Now, obviously, there's time periods that when you're very busy or everything's tied up at another call, that's not in everything, all the time statement.
I think I lost you. Hello?
Yes, you there?
Yeah, I'm here. I'm here.
The chief had answered
here.
your question. He had finished talking.
No, pardon me? Pardon me?
I was just telling you the chief had answered your question. He had finished.
Okay, thank you. So I guess the thrust of it is that it's been a benefit then to close the two volunteers stations on this side of my town versus the east side. Is that the conclusion? Or was
No,
it...
I would absolutely say it's not a benefit. That's not something that we can control. In a volunteer system, the stations are located in proximity to the membership of that station. So because this is a very large town, the membership that supplies East Wallingford and the membership that supplies North Farms lives very close to that station within that district in most cases, because they have to respond to get to the station to then get the truck out. So it's a byproduct of not having members in the two stations on the west side of town. It's not a benefit by any stretch, but it's a product of the health of that station, that company, and that's why it was not done by design, by any desire. No.
So you would prefer to have more volunteers on the west side? Is that what I'm to assume?
I'd like to have more volunteers townwide.
All right. Well, you know what? I think that is great, and I just think that we should probably focus more on that, because I don't know that has ever been expended to anybody, whether it be government TV or anything, that anybody's looking for that, because I think that as a town-wide concern, maybe some of these people that are in the Eagle Scouts or Boy Scouts or something growing up, that maybe they get tours of these facilities that you guys have, that maybe it would influence some volunteerism to get involved with it. But anyways, thank you very much for your time, and I appreciate your answers.
That appears to be all we have for questions. That being the case, Madam Clerk, would you please call the roll?
Yes. Fishbein,
Yes.
Laughlin,
Yes.
Marone,
Yes.
Morgenstein,
Yes.
Shortell,
Yes.
Tata,
Yes.
Zandri,
Yes.
Chairman,
I'm here. Test
Oh,
is here.
I
That's it. I
apologize.
logged on about right after the pledge, so I've been here for the meeting and I vote
Oh.
yes.
Thank you.
You're welcome.
And Chairman Cervoni?
Yes. Motion passes. That being all the business we have on our agenda tonight, I declare the meeting adjourned. I will stop the recording and close the meeting.
This conference is no longer being recorded.